Good afternoon. My name is Aarti Janardhan Parkare. Today I am going to tell about the subject pharmacovigilance, and the topic name is causality assessment. The causality assessment in pharmacovigilance is the process of determining the likelihood that a drug or other medical product caused an adverse event. It's a crucial step in understanding drug safety and making informed decisions about medications uses. This assessment involves analyzing various factors to establish the causal link between drug exposure and an adverse reactions. The some causality assessment purposes to determine the probability of a causal relationship between a drug and an adverse event, helping identify potential safety corners and manage risk. The causality assessments method, the first one is the expert opinion. In expert opinion, a consciousness based approaches relying on the knowledge and experience of expert in the field. Second one is the algorithms. In algorithms, predefined algorithms like a WHO causality assessment scale and Naranjo scales provide a structured approaches for evaluating causality. The third one is the probabilistic approaches. In this, the statistical models can assess the probability of a drug causing an adverse event. Next one is the factor considered. First one, the temporal relationship, the timing of the adverse event in relation to drug administration. Second one is the biological plausibility, the whether the drug's known mechanisms of action could explain the observed adverse event. Third one is the alternative explanations, ruling out other uh, potential causes of the adverse event. Fourth one is the dose response relationship, whether there is a clear link between the drug's dose and the severity of the adverse event. The some important points is causality assessment. The first one is the identify safety signals, helps pinpoint potential problems with a drug and initiate investigations. Second one is the supporting regulatory decisions, provides evidence for regulatory actions such as a label changes or drug withdrawals. The third one is the informing clinical practices. The helps healthcare professionals understand potential risk associated with certain medications and make informed decision about the treatment. In the causality assessment initially means finding causal association or relationship between a drug and drug reactions. Identifying the culprit drug or drugs can be life-saving or helpful in preventing the further damage caused by the drug or our body systems. In dermatology's practices, when it comes to cutaneous adverse drug reactions such as this is the much more important than relevant because many etiologies can produce a similar cutaneous manifestations. There are multiple criteria or algorithms available as of now for establishing the causal relationship in cases of adverse drug reactions indicating that none of them is a specific complete. Most of these causality assessment tools used for four cardinal principles of diagnosis of a ADR, such as a temporal relationship of drug with the drug reactions, biological plausibility of the drug causing a reaction, de-challenges and re-challenges. The present study reviews some of the established or commonly used CATs and its in implications or relevance or to determining dermatologists in the clinical practices. the causality assessments. This short information about causality assessment. Thank you.